how do I dose this? What doses work? What should I look for as a target dose? The answer to that question really is there isn't. What we've really learned, especially over the last 5 to 7 years, is that it's really about you and your issues, mainly because whether we're dealing with chronic pain or we're dealing with autoimmune disease, most people are very, very sensitive to medications. And it's okay to say that, by the way. It's really okay. And what we've learned is that that sensitivity is telling us that the body is ready for newer opportunities. And a lot of time, especially with autoimmune, rarely does somebody have just one. Usually there's several going on. They may not be diagnosed, but they're there. So we usually start very low and slowly work up. So the protocol once upon a time used to be start at 1.5 milligram, go to 3, and then 4.5. And that does work for some people. But we're hearing more and more questions about, I started at 1.5, I went up to 3 milligrams, and yet now my stomach is really upset and I have headaches. Well, that tells me your dose is too high. So we need to move it back down. And it's okay to move down. It doesn't mean the drug isn't going to not work. In fact, we have studies that show that microgram or ultra low dose naltrexone works. It just depends on the disease state. So when we're looking at dosing, there are guidelines that we can use based on the disease states. But the old way of 1.5, 3, going up to 4.5 only catches, I think now some of the data that we're looking at catches about 30 to 40% of the people. I don't even think it catches half of the people anymore, because some people are trying multiple times a day dosing, especially for chronic pain. So what I will also add to that is that LDN is always worth a shot. It's always worth trying, because the beauty of LDN is that you can stop at any time. You don't have to wean off. There's a few medications that we have to be, a little bit more sensitive with, but most of the time we don't have to worry too much about that.
If I can jump in there for a minute.
Yeah.
If people start on dose that's too high, by reducing it, I think people could have misunderstood what you were saying, that it's only going to work for like 30% of people. But that was with that protocol. But
yes,
if they drop lower and go slow and find their sweet spot, the success rate is, I asked our medical advisors, yes, it averaged between 96 and 98%. And Dr. Pamela Smith, if the audience are listening here, she always says all her patients get 100%. The reason they get 100% is she doesn't stop trying. She tries different things. She adds different supplements. She never gives up until eureka, they've got it. It's
Yay.
working for them. But if you go to a provider who sticks to the, going back 20 years when I started LDN, it was even worse, because it was 3 milligrams for a month and then you went up to 4.5. And if it didn't suit you, well, it's not going to work, because everybody back then, if you weren't on 4.5, you weren't on the right dose.
right.
That was the dose for everybody. But now we know that some people, 1.5 is as high as they can go. And it might take them a while to get to 1.5.
Yes.
It is so individual, isn't it? So
Everybody.
Sorry to jump in there.
No.
Do carry on.
Absolutely. No, it's absolutely wonderful to get clarification, because that is the bottom line, is that if we treat the individual, and this is the one thing that I've been working with a variety of pharmacies, compounding pharmacies across the United States, is that there are ways for us to stay in touch with the patient. So just because we dispense the prescription and the patient starts taking it, that doesn't mean that that's the end of the conversation. We need to continually ask questions of the patient. How are you doing? What's going on with these different symptoms that they may or may not have? Some people don't realize that their symptoms are less. They may not be 100% gone, but they have lessened. And that's still a win. That is still very important to keep track of. So there are platforms, online platforms by which patients can type in their questions. It might be 11:15 p.m. their time, right? But they can't get to sleep, or they have a question about something. They can actually type it in, and then it will go to the pharmacist the next morning. The pharmacist can answer it and get right back to them. Because what we've learned is that when patients don't have a full understanding of, we need to keep tweaking, we need to keep trying, I need to hear about your experience, instead they just stop. They assume that they had a flare or they had a symptom that just all of a sudden popped up, and the last thing they added was low dose naltrexone, so it had to be the LDN, so they just stopped it. Well, in some cases, unfortunately, some people feel worse before they feel better. But that doesn't mean we need to stop. A lot of times what that means is we need to back up the dose and then stretch out the interval by which we may increase. We have patients that are taking 0.6 milligrams or 0.8 milligrams a day. I mean, they're not even at a full milligram yet, and they're doing really well. Are they 100%? No. Are they going to get 100% resolution? I don't know. We have to give it some time. A lot of people have literally been dealing with their disease states for years, maybe even decades. And they've been through how many providers, right? Many, many, many providers. It doesn't matter who you are seeing. If they are open to writing a prescription for low-dose naltrexone, there's usually a compounding pharmacy that can help track things for you and with you, so that when you're going along your journey, we're able to fine-tune things. So we can do the heavy lifting, and with that, we can then collect the data so that we can support answering more and more questions.